Hey, it's Dr. V, your favorite Psych NP. So working in an outpatient mental health clinic, today I had a total of 16 patients scheduled. I had one psych eval and I had two no-shows. For the psych eval, they were 30 minutes late. It's a 13-year-old kiddo, and I just told them that it wasn't enough time for me to do a full psychiatric evaluation, that they would have to reschedule. They weren't happy because they had to wait a long time to get to this appointment, so I just encouraged them to be on time for the next appointment. As far as cases today that were a little complicated, I had one patient that is a 7-year-old kiddo with ADHD and autism, struggling with sleep. What I did, I don't really like prescribing melatonin that often, but specifically for autism spectrum disorders, they produce less melatonin in the brain naturally. So I did prescribe 3 milligrams of melatonin to use, not for a long time. I didn't prescribe it for more than 30 days. I told them to use it intermittently until they get the sleeping schedule adjusted. The key thing with melatonin is to give 4 hours before bed. So that was kind of interesting. Another patient that I had was a 42-year-old male with moderate intellectual disability, mood disorder, and also uses sign language to communicate. He has a pending appointment for his immigration status. So I wrote an accommodation letter because he does get very anxious, worried, and sometimes aggressive around the police. So I wrote a letter saying that when he does go do his interview, that he might need more time, more accommodations, such as a private room with less people. And I also did prescribe Ativan 1 milligram to be given prior to his interview, and that went very well. Another patient that I had that was going through something was a 47-year-old female with history of bipolar, history of substance use, both pain pills and alcohol, and she recently had a relapse and she had to be admitted to the hospital for like 2 weeks where they stabilized her, and then she was released. The only new thing I did that I've been trying to push for her is naltrexone. Naltrexone is a medication that helps with substance use, specifically alcohol and impulsivity. So I prescribed that for her. She is stable now, she's not drinking, and she has social support. So I'm hoping that that helps. The key thing with naltrexone is that it works when you take it, but sometimes people just decide to stop taking it because they want to have a drink. So I did offer the long-acting injection that you give once a month called Vivitrol for later on if she does find benefit from the oral medication. Another patient that I had, 32-year-old female, autism spectrum disorder, level 3, so it's severe. And she recently stopped going to her day program because of other people just causing her a lot of dysregulation, and people just not being able to help her and control the other kids. So now she's not going to the program anymore, which is causing a lot of frustration at home with mom and her just wanting to kind of sleep all day, which she wasn't doing before at her day program. So for that, I didn't change any medications. I just recommended a ABA therapist to come to the house. Very difficult to do just because of resources. So I also added a behavioral coach to come help and take her out of the home. Sometimes these changes really can't be helped with medications, and it's more of the environmental. Another case that I had that I've been struggling with is a 33-year-old male, history of bipolar, insomnia, and anxiety, and he has not been sleeping. Last time I saw him, I started him on hydroxyzine 50 milligrams, and I doubled his Lunesta from 3 milligrams to 6, and it did absolutely nothing. He said he was able to sleep for like 1 to 2 hours more, but it really didn't help. So what I'm going to do with him is I switched him to Ambien 10 milligrams, and I told him that if that doesn't work, then I will add a low dose Seroquel to his regimen. So we'll see how he does. Another significant case that I had was a patient that was a 7-year-old male. I had seen him in December. I diagnosed him with ADHD and pervasive developmental disorder. Here in Arizona, Psych NPs can't diagnose autism spectrum disorder, so it has to be done by a pediatric psychologist or a pediatric psychiatrist. So he went based on my referral and came back with the diagnosis of level 2 autism. I just had him on guanfacine twice a day. He was doing really well when we started in December, followed up with him in January, doing well, but this time that I saw him, the hyperactivity has increased, and the school is struggling even with the IEP program to get him regulated. So I pulled the trigger and I started him on Concerta, one tablet in the morning, extended release. So I'm hoping he does well. The only thing I'm going to do with him is order a EKG to make sure his heart is okay. And then let's see, another significant patient that I had was probably the most interesting and the one that you might find some curiosity. She's a 37-year-old female, history of bipolar 2 disorder and anxiety, very stable with Latuda, lorazepam, 16 milligrams per day, and hydroxyzine. She recently got married, bought a house, got a new puppy, and went into full-blown mania for about a week. She said she was able to stabilize herself, and all that really happened was increased spending. But I didn't want to highlight that sometimes during the changes from winter to spring is when people are most at risk to develop mania or hypomania, with that change in 24-hour circadian rhythm, the sun, plus paired with all the additional stressors that she had. So she's stable now, and I'm really happy that she is. So I didn't make any medication changes, but I just told her to monitor those moods. And I also recommended therapy because she hasn't done therapy since 2023 to kind of get ahead of that and be able to kind of deal with life stresses and kind of come and vent to a therapist when she needs to. So overall, a great day in clinic today. Very happy, very proud of my work. And as always, thank you for watching. Thank you for listening. Any questions, please drop them in the comments. And if you're thinking about a career in mental health, it's definitely a high needs job where it also takes a toll on you mentally, emotionally, and sometimes physically. So I do recommend that you do get into mental health. You have a very set regimen for yourself that you follow. You have great coping skills. And if you need therapy, go ahead and start therapy before you start to help other people that are distressed. Thank you for watching. Thank you for listening. And I'll see you on the next one.